Urinary dysfunction is often associated with Parkinson's disease. The urinary bladder is a key component of urinary tract which controls two aspects of urination. It regulates the storage of urine and eventual release of urine when it is appropriate to do so. In urinary dysfunction, these functions of bladder are impaired. In case of storage of urine, the bladder sends signal to the brain indicating that it is full even though it is not. The result is that the need to urinate is experienced more frequently. This symptom also occurs at night time and is called nocturia. Therefore, this condition may interfere with your sleep. Also, the ability to control urination decreases in Parkinson's disease. It becomes harder to delay urination when the need arises. This symptom can be challenging when you find yourself in public places. Another problem you may face is decreased ability to empty your bladder. This may also lead to increased frequency of urination. If the bladder does not empty properly on regular basis, the chances of getting a bladder infection arise. A sign of bladder infection is pain during urination. Some of the other symptoms of urinary dysfunction include increased frequency of urination, dribbling of urine after you have just finished urinating, and inability to delay urination. Other symptoms include an urge to urinate even though you just went to the bathroom and urinating small amounts at a time. Uncontrollable leakage of urine is also associated with urinary dysfunction. Aside from Parkinson's disease itself causing urinary dysfunction, some of the drugs used to treat Parkinson's disease, especially the drugs with anticholinergic effect, may impair bladder function. Sometimes in men, urinary dysfunction may not be associated with Parkinson's disease at all. An examination may lead to the conclusion that the prostate disease is the cause of urinary dysfunction. In this condition, the prostate is abnormally enlarged and affects the flow in the urinary tract. One thing you can do to decrease your symptoms of urinary dysfunction is to reduce your intake of fluids with diuretic effects. Diuretic drinks are those which increase your need to urinate. Drinks that contain caffeine and alcohol are diuretic. Some other examples are tea and grapefruit juice. You may also want to keep track of when you drink fluids. In order to reduce the amount of time you have to get up at night, you should avoid drinking fluids a couple of hours before you go to sleep. Also, you may want to limit drinks before you plan to go out of home. Washroom emergencies in public venues can be problematic and sometimes embarrassing. However, you need to make sure that you get enough fluids on a daily basis, since constipation is also associated with Parkinson's disease. If you are slow enough in getting to the washroom or have issues with mobility, you may consider getting a bedpan or a urinal to assist you. Clothes that are easier to undo or take off should be worn at night time. For men, a condom catheter is also an option. However, if you lack voluntary control over urination, you may need protective padding or cotton underwear. Odor problems can occur with use of protective padding. Cranberry juice is also known to lessen the effect of odor. Control over urination can be increased with exercises that strengthen your pelvic muscles. You can also increase your control by practicing alternatively delaying and initiating urination. Bladder retraining is also useful for reducing symptoms of urinary dysfunction. It consists of urinating at scheduled times even if you don't need to go. If these measures are not helpful, your urologist may start you on medications. The first step you need to take is to inform your healthcare team about your symptoms of urinary dysfunction. From there, you may be directed to a urologist who will assess and determine if Parkinson's disease is a cause of urinary dysfunction or if there is any other problem responsible for this symptom. Therefore, a consultation with a urologist is recommended. This information is provided for educational purposes only and should not be taken as a substitute of the medical care provided by your physician.